Good evening, everyone. Guys, am I audible and visible to everyone? Please write down in the comment section. Yes. Yes, we can start, guys. Just update me once. Am I audible and visible to all of you? Sure, sure, sure. Okay. Thank you, guys. So let's begin with the session, guys. Good evening, everyone. I hope you all are doing good and studying for the exams. Day by day, we're getting closer to the 6th of July. So today, guys, this will be a part 3 of high discussion of the PSM. We have already discussed 2 parts and you can check out them in the live video sections. Good evening, good evening. So before starting the session, guys, we'll be solving some around 15 questions and 15 topics we'll study in detail. Okay, and hopefully they are the high yielding topics. Yes, they are the high yielding topics and the topics that have been asked repeatedly in the exams. So guys, for yes, to boost your preparation, guys, yes, you have to watch part 1 and part 2. That will be very useful. Okay, so part 1, part 2 questions we have already done, guys. So we're starting with the part 3. Okay, we are good to go, guys. So without any further delay, guys, let's begin with the part 3 of high discussion of PSM. Is it clear? Total I have given 3 parts of high discussion, around 4 to 5 hours. Yes, but this is only useful when you go through your main notes first. Okay, you cannot directly rely on this. Okay, I'll advise you guys, please read out your notes first. Okay, then it will be a useful thing. Okay, because I'm not going in a full detailed explanations. Chalo, guys. Epidemiology. Yes, I will cover a bit epidemiology as well. I've already covered it in a part 1, part 2, some studies, but today also one part of studies. I'm starting with that only. Okay, chalo, guys. Okay, let's begin, guys, without any further delay. So let's start with the question number 1. Which phase of the clinical trial checks the efficacy? Okay, main point is which phase of the clinical trial checks the efficacy and monitors the adverse reaction of a new drug. Okay, now my dear students, if we remember from the part 1, when I talked you about a bit epidemiology, over there, if we talk about a classification of these epidemiological studies, we have 2 things. Okay, let me show you a clear cut view. Okay, now we have 2 things. We have observational and we have experimental. First of all, we try to make this hypothesis. We form this hypothesis with the help of a time, place and person. Okay, with the help of a time, place and person. Okay, then analytical hypothesis. We test this hypothesis with the help of a studies like cohort study, case control study, cross-sectional study and ecological study. Okay, then in experimental classification, we confirm this hypothesis. With the help of a clinical trial, randomized control trial, field trial and community trial. Okay, did you understand now where exactly this clinical trial is coming from, guys? It's a classification. If we go for the classification of the epidemiological studies, for confirmation of this hypothesis, we are doing a new for confirming this hypothesis for a new test, we're doing for a new drug, and we evaluate the effect of that particular drug on a human population. Okay, so that's called a clinical trial. Okay, so for example, if the drug is coming, okay, getting back, if the drug is coming into the market, okay, it's going through a clinical trial. Okay, and in this clinical trial we have a series of events that will check about a safety of a drug, that will check about the dosing of the drug, that will check about the efficacy of the drug, that will check about the side effects of the drug, and as well as comparing to the same drug in the market. Okay, so different clinical so in clinical trial we have a different phases. Okay, so write down, guys, we have a preclinical trials that we do first, preclinical trials, and these preclinical trials we do on animals. Okay, preclinical trial on animals, preclinical trial on animals. Okay, after that guys, we have phase 0. We have phase 0. Okay, micro dosing. We'll do micro dosing on health volunteers, HHV. Okay, we'll do a micro dosing on them in phase 0. Okay, in phase 1 of clinical trial, we'll check a safety of the drug. We'll check the safety of the drug. In phase 2, we will check efficacy of the drug. In phase 2, we will check efficacy of the drug. Okay, in phase 3, we'll compare with the existing drugs. We'll compare with the existing drugs. We'll compare with the existing drugs. Okay, for example, you might have seen guys amoxicillin or potassium clavonate. It's of different companies. So when a new drug is coming into the market, we compare these two drugs. Okay, and that is done in which phase of clinical trial? Phase 3. And phase 4 is when the side effects of this drug are checked. Okay, so check long-term side effects. Check long-term side effects. To check the long-term side effects, we go with the phase 4. So these are the phases. Preclinical trials we'll do on animals. You might have seen on rabbits, rats. Okay, preclinical trial. Then we go with phase 0 microdosing on health volunteers. Then phase 1, we check the safety of the drug. Phase 2, we'll check the efficacy of the drug, that what is the potential of a drug to treat a particular infection. Phase 3, compare with the existing drugs. And phase 4, we check the long-term side effects. Okay, now guys, few one-liners I will add on here. The longest phase among all. The longest phase among all. Which phase of the drug is the longest phase, guys? Phase 4. Then if I talk about randomized controlled trial, that is done in phase 3. Randomized controlled trial, that is done on phase 3. Most important phase. Most important phase. Also phase 3. If I talk about maximum tolerated dose of the drug, maximum tolerated dose of drug, that is phase 1. Okay, maximum drug failure, last one guys, maximum drug failure. Maximum drug failure will take in a place when you are comparing the drug with the existing same drugs. Okay, maximum drug failure will be when the drug has no efficacy, that is phase 2. For example, you are still taking 1000 mg of an amoxicillin, but you don't feel any difference. Are you getting my point? That means no matter how much dose you are increasing, still there is a no effect. That means the drug has no efficacy. So that is maximum drug failure seen in which phase, guys? Phase 2. Is it clear, guys? So all these things, guys, very important. Phase 0 for the microdosing, phase 1 for safety, phase 2 for efficacy, phase 3 comparing with the existing drugs, phase 4 check long-term side effects. So simple question was asked that efficacy will be checked in which phase? Everyone, phase 2. Efficacy will be checked in phase 2. Okay, so let's move to the second question, guys. So I have told you multiple times, question might feel easy, might feel PYQs, but our main goal is to understand and remember the full topic. Okay, our main goal is to understand and remember the full topic. Chalo. Now second question. An infant was brought to the PHC, primary health center, for immunization. Okay, immunization questions will come, guys, very important. UIS, Universal Immunization Schedule, questions will come from the vaccines and immunization. He was vaccinated by the nurse who reconstituted, the vaccine with the sterile water. That's a hint, guys. Diluted the vaccine or reconstituted the vaccine with the sterile water before the administration. Which among the following vaccine the nurse has likely administered? which among the following vaccine the nurse has likely administered. Okay, so if we talk about the diluents of the vaccine, let's talk about the diluents of vaccine. If we talk about the diluents of the vaccine, guys, normal saline for BCG vaccine, yellow fever and dengue. BCG vaccine, yellow fever and dengue. Okay, if I talk about Japanese encephalitis, if I talk about Japanese encephalitis, the diluent is phosphate saline buffer. The diluent is phosphate saline buffer for Japanese encephalitis. And if I talk about distilled water, that's for MR, measles and rubella. That's for MR, measles and rubella. ठीक है guys? Done. So here the question was, what was the question, guys? With the sterile water, so what is the answer? MR. So your answer will be measles and rubella. So remember these diluents of the vaccine. If I talk about the vaccines that are available in the liquid form, that don't need a diluent. So what are the vaccines available in the liquid form? Vaccines available in liquid form. What are the vaccines? Remember guys, hepatitis B, TT, tetanus toxoid and diphtheria pertussis, DPT. Okay, then guys, if we talk about the dosage, of the vaccine, 0.5 ml for DPT, hepatitis B, MMR and Japanese encephalitis, 0.5 ml. So remember 0.5 ml for this. If I talk about oral polio vaccine, you have to give 2 drops. You remember that, that's 0.1 ml. And if I talk about rota vaccine, that's 5 drops, around 0.25 ml. So this was about the dosage of the vaccines. Okay, about the tetanus toxoid, they can ask you the question from the tetanus toxoid in the pregnancy, how much TT you have to give, guys. It's a very important question, guys, from the pregnancy point of view. How many doses of tetanus toxoid you have to give? Remember, if the patient is a primary gravida, what do I mean by primary gravida? Who is conceiving for the first time. Are you getting my point? What is primary gravida? Who is conceiving for the first time irrespective of any abortions. Okay, conceiving for the first time, primary gravida. You have to give how many doses, guys? 2 doses. कितने देने TT के? I am talking about tetanus toxoid, 2 doses. Okay, if I talk about multigravida, this can be the question they can ask. Multigravida, if the last childbirth, LCB, last childbirth is less than 3 years, if the last childbirth is within 3 years, you have to give 1 dose. And if last childbirth is more than 3 years, okay, if his last childbirth is more than 3 years, you have to give 2 doses. Okay, what do I mean by LCB? Just remember, guys, don't make your own abbreviations. Then last childbirth, फिर और कुछ तुम लिख दोगे, last childbirth. Okay, so remember this thing, guys. Multigravida, if she is a multigravida, that means she has conceived more than once. Okay, so last childbirth within 3 years, you have to give 1 dose. If last childbirth more than 3 years, you have to give 2 doses of tetanus toxoid. Okay, so that was all about a bit vaccine. So remember diluents of vaccine, guys. Normal saline for BCG, yellow fever and dengue, number 1. Japanese encephalitis, remember that is PSB, phosphate saline buffer. Distilled water for measles and rubella. Then the vaccines which are available in the liquid form, we have hepatitis B, we have tetanus toxoid and we have DPT. Okay, then the doses of the vaccine, mainly 0.5 ml OPV guys, 2 drops 0.1 ml, rota vaccine 0.25 ml. Okay, remember the adverse effect of vaccines as well. If asked mainly guys, the rota vaccine has a side effect of, anyone in the comment section, rota vaccine has a side effect of, what is the adverse effect of rota vaccine? It causes red color jelly stools. Your diagnosis is interception, sausage shaped lump. Interception. Then guys, rest interception you will study in the surgery, but itna rakho yaad, red color jelly stools, classical finding of interception hai na, and sausage shaped lump. So the question can be asked that a mother came to the department, emergency department, complaining of a pain, nausea in the baby, okay, red color jelly stools, and upon the examination, sausage shaped lump was there, and which of the following vaccine can cause such an adverse effect? So which vaccine guys? Rota vaccine. Which vaccine? Rota vaccine. Chalo. So interception, I've already mentioned the adverse effect guys. I've already mentioned the adverse effect, I guess, in the above. What are the adverse effect of the vaccines? So remember this adverse effect. What is the adverse effect of the BCG vaccine? Anyone in the comment section? Adverse effect of the BCG vaccine? It causes miliary TB as a side effect. ठीक है ना? चलो, it will come, I guess. Then I've not discussed, but yes, I'll be discussing all the adverse effect of these vaccines. Next question. A child on examination. So it's done guys, everyone. Write down in the comment section. Done? Chalo. Next. A child on examination has a finding given in the image below. Given in an image below. It belongs to WHO class. It belongs to which one guys? We already know it as a most common clinical sign. It's a most common clinical sign in vitamin A deficiency guys. Most common clinical sign in vitamin A deficiency called as Bitot spot. Bitot spot. Okay, and what will be your answer guys? A child on examination. A child on examination has a finding below. So before that guys, let's discuss what are the signs. So WHO has mentioned the signs, primary signs and secondary. Primary signs. And second, we have secondary features. Recent question was asked in a PSA examination guys. Remember all these questions. Not every time they will give you a vitamin A. Not every time they will give a vitamin A deficiency Bitot spot. Okay, the question was asked, Bitot spot, okay, X1B and other features as well. Which of the following is a primary sign? Which of the following is a primary sign? So we'll discuss primary signs and secondary signs, secondary features. Okay, in primary signs guys, first one we have X1A, which is related to the conjunctival xerosis, dryness, conjunctival xerosis. Number second, X2, okay, corneal xerosis. Corneal xerosis. X3A, corneal ulcer or scar. Corneal ulcer or scar. Vitamin A question is very important. Vitamin is very important. Vitamin B12, B9 and vitamin A, very very important. Okay, multiple questions. If I talk about X3B, that is keratomalacia. That is your keratomalacia. Okay, these are all the what? Primary signs. Okay, in the second part guys, if I talk about the secondary signs, if we talk about the secondary features, okay, remember we have N, that goes with the night blindness. We have XF, xerophthalmic fundus. Xerophthalmic fundus. We have XS, xerothalamic scar. Xerothalamic scar. So that was all about your primary signs and secondary features. So it was asked that which of the following is a bitots, guys. It's X1B. Your X1B is bitots spot. Okay, X1B is bitot spot. Okay, what is the first symptom, guys? So let's discuss more about a vitamin A deficiency. We have already discussed that the dosage of the vitamin A deficiency. I will again have a quick review about a dosage, guys. First symptom, you always remember, first symptom is night blindness. Okay, what is the first symptom, guys? It is night blindness. First sign of the vitamin A deficiency will be conjunctival xerosis. Most common clinical sign will be bitot spot. The most sensitive screening test are your serum retinol levels. Okay, the question they ask from the dosage of the vitamin A, guys, if the patient is coming less than 6 months, according to the universal immunization schedule, guys, at 9 months along with the measles you have to give vitamin A. But if less than 6 months there's a vitamin A deficiency, 50,000 international units. Less than 1 year, that means 6 months to 1 year, between that if the patient comes to you, you have to give 1 lakh international units. More than 1 year, you will give 2 lakh international units. And if the baby is less than 8 kg, then the dose given to the baby divide by 2. If the patient is coming to you 14 months baby, that's what was mentioned in the question, guys. 2-year-old baby. Okay, so 2-year-old baby, according to the age, how much vitamin A you have to give, guys? More than 1 year, you need to give 2 lakh international unit. But the weight was 7.5 kg. So if the weight of the baby is less than 8 kgs, how much you need to give, guys? 1 lakh international unit. Okay, so remember the dosage, it's very important question. Total doses, you have to give 9 doses, guys. Amount total, it's 17 lakh international units, and you have to give this every 6 months till 5 years. Every 6 months till 5 years, and route is orally. Okay, the richest source is halibut oil, second is liver oil, and vegetable richest in vitamin A is carrot. One important thing you will remember that, guys, that 1 ml of vitamin A, 1 ml of vitamin A is 1 lakh international units. It's 1 lakh international units. So it's all about vitamin A, guys. Every single thing, all the possible questions. One question, what WHO sign of a bitot spot? Second question, the dosage of the vitamin A. Third question, that richest sources or retinol levels. Fourth question, they will ask, it's given every 6 months till 5 years, every 12 months till 5 years, every 18 months till 5 years, or every 6 months orally. Okay, remember, guys, orally. Okay, they will mention in the options intramuscular, intravenous, but you have to remember orally every 6 months till 5 years. Okay, and recent question was asked in one exam, guys, primary and secondary features. So remember, what are the primary signs and secondary signs? So that was all about vitamin A. So here it's a diagnosis of bitot spot X1B. Is it clear to everyone, guys? Is this clear to everyone? Chalo, write down in the comment section, clear to everyone? Yes. Now the next question, guys. Next question. Maize is deficient in which of the following amino acid? Okay, this can be the question related to the biochemistry as well, and here the PSM as well. So maize is deficient in which of the following amino acid? One thing I would like to mention here, guys, PSM is all about, you have to remember, there is nothing conceptual. Ratta marna hai PSM. Are you getting my point, guys? So remember PSM. You have to remember anyway. There is no particular concept we'll understand, like in OB-GYN. We understand that a patient is coming, okay, patient is coming with the complaints of a labor pain, placenta is 2 centimeter away from the os, okay, fetal heart rate is this much, okay, that is a conceptual thing. But here you remember, you know, you don't know, baat khatam. Okay, so what is the answer here? Maize is deficient in which of the following? Lysine, tryptophan, threonine, both A and B, lysine and tryptophan. Read out the options well. Okay, so let's discuss first and then we go to the answers. If I talk about the principal foods, okay, foods and their deficient amino acid, if I talk about cereals, okay, the deficient amino acid we have lysine. The deficient amino acid we have lysine. If I talk about maize, okay, MLT, you remember lysine and tryptophan. MLT, that is lysine and tryptophan. Tryptophan. If I talk about wheat, that goes to your lysine and threonine. Lysine and threonine. And if I talk about pulses, PCM, C for cysteine and M for methionine. Cysteine and methionine. Cysteine and methionine. Okay, so the question was, guys, remember the question was that the maize is deficient in. So what will be the answer, guys? Write down in the comment section. What will be the answer now? So it's both A and B, that is lysine and tryptophan. Okay, it's not only tryptophan, guys, it's lysine and tryptophan. Okay, and tryptophan deficiency. From tryptophan, which amino acid is coming, guys? From tryptophan, which amino acid is coming? Sorry, from tryptophan, what is coming? Which vitamin is coming? So vitamin B3, that is niacin. Okay, when the niacin is decreased, we have which symptoms? We have pellagra. Okay, 4Ds. What are the 4Ds, guys? We have dementia, we have diarrhea, we have dermatitis, and we have death. Okay, dementia, diarrhea, dermatitis and death. Is it clear to everyone, guys? Pellagra like symptoms. You have a casal neck, है ना? कौन सी appearance मिलती है? Casal neck appearance. Okay, let me find if there is a picture here of casal neck. Yeah. Okay, casal neck appearance. Is it clear? That is also a question repeatedly asked in the FMG exams. Is it clear? Chalo, guys. And remember, guys, tryptophan. And remember one more thing, guys. 60 mg of tryptophan. 60 mg of tryptophan required to produce 1 mg of niacin. Is it clear? So remember, guys, cereals, lysine, MLT, lysine and tryptophan, wheat with lysine and threonine, and pulses with PCM, cysteine and methionine. Cysteine and methionine. Very good, guys. All of you guys, Niaz, Khatun, whosoever, who has all of you guys, right? Good. Keep answering and be interactive enough so that you understand. Is it clear, guys? So vitamin B3, niacin was done. Tryptophan. Okay, what else comes from the tryptophan? Tell me in the comment section. Tryptophan से और क्या क्या आता है? From tryptophan, what else is coming? Which other amino acid is coming? Which other substances are coming from the tryptophan? Yes, in the comment section, write down faster, guys. What else is coming? Yes, tryptophan. What else? Melatonin. Very good. and serotonin. Melatonin and serotonin. ठीक है ना guys? And what is the tumor related to the serotonin, guys? Melatonin is a sleeping hormone. Yes, that's why the drugs you will give tryptophan. Okay, relating. Are you getting my point? Then the carcinoid syndrome when there is an excess serotonin, guys. Tumor of the argentophin cells. Okay, carcinoid syndrome. What is the investigation of choice? 5-HIAA. Okay, indole acetic acid, and your drug of choice will be a somatostatin analog octreotide. Your drug of choice will be a somatostatin analog octreotide. Okay, so from tryptophan, niacin, melatonin and serotonin is coming. Is it clear, guys? So remember, serotonin related a syndrome, carcinoid tumor, a carcinoid syndrome, patient complaining of diarrhea as well, and investigation of choice is 5-HIAA, indole acetic acid, and remember the drug of choice is a somatostatin analog octreotide. Okay, so about that tryptophan. The upper class score of Kuppuswamy scale. The upper class score of the Kuppuswamy scale. So let's discuss what exactly is this Kuppuswamy scale, guys. This is a scale for the measurement of. This is a scale for the measurement. This is the scale for the measurement of socio-economic status. Socio-economic status in which areas, guys? Urban areas. कहाँ पे? In urban areas. It's the socio-economic status. It's for the measurement of the socio-economic status in which areas? Urban areas. Remember, guys, before the question was asked that what exactly are the components? What exactly are the components or the criteria of a Kuppuswamy scale? So remember, guys, education of head of the family, education, occupation and income. Okay, education, occupation and income. Okay, they will be asking you the question, guys, which of the following is not a component of a Kuppuswamy scale? Education, occupation, income and housing. So housing is not included in the criteria. So three things you will remember, guys: education, occupation and income. The total score of Kuppuswamy scale is 29. The total score is 29. The total score is 29. Okay, the upper class score is 26 to 29. Okay, the middle class score it's 16 to 25. Okay, middle lower it's 11 to 15. Lower upper it's 5 to 10, and lower is less than 5, and lower it's less than 5. So upper class score. So how much is the upper class score, guys? Here it's 26 to 29. So remember this Kuppuswamy scale. It's a scale used for the measurement of socio-economic status. I will write it here: socio-economic status. Okay, they can make a question in a way that which of the following is true about a Kuppuswamy scale? Okay, question number 1, that education is in the criteria. 2, occupation is in the criteria. 3rd, it is a measurement of socioeconomic in urban areas. 4th, in rural areas. So which of the following is wrong, guys? Your answer goes to the rural areas. Further, guys, let's discuss the further question. Which of the following committees are proposed the reorientation of health education Rome scheme? Okay, if we talk about committees, faster guys. The first committee, guys, we have a board committee. Okay, PSM ने board किया, so remember it that way, guys. Board committee. What was this board committee, guys? It says that there should be one primary health center for the 40,000 population. PHC concept was given by the board committee, guys, and it says that a physician, that doctors have to go for 2 months of internship in the PSM department. Okay, 2 months of internship in the PSM department, and it's also known as health survey and developmental committee. It's also known as health survey and developmental committee. Health survey and developmental committee. Okay, second thing, guys, so which committee gave the concept of PSM internship for 2 months? Board committee. Second one is a Mudaliar committee, guys. It gives the concept of all Indian health services, and it's also known as health survey and planning committee. Health survey and planning committee. Health survey and planning committee. Okay, then for the maintenance malaria control, guys, which committee? Chadda committee. Mukherjee committee, basic health services. Jangalwala committee said there should be no private practice for the government officials, equal pay for the equal work, and the integration of the health services. Kartar Singh committee said that A&M should be replaced by the multi-purpose worker female. Okay. Srivastav committee said that the concept of reorientation of medical education and village health guide concept, it was given by the Srivastav committee. Is it okay, guys? So remember, village health guide concept and Rome concept was given by Sri Vastava. So here, guys, which committee gave the Rome scheme and a village health guide concept? Sri Vastav committee. Your answer goes to Sri Vastav committee. Is it clear, guys? Okay, so committees, they used to ask the question on the committees as well, but from last 2 years, no questions on the committees, but they can ask anytime. Don't trust NB. Chalo, a cardiologist, okay, very important question, guys. A cardiologist wants to study the effect of an atorvastatin drug. Okay, a cardiologist want to study the effect of an atorvastatin drug. Atorvastatin is a which class of drugs? It is a hypolipidemic. Remember this line? It's a hypolipidemic drug, guys. Statins में आ जाता है. It inhibits which enzyme? HMG-CoA reductase. I'm adding this point as well. It inhibits which drug? Which enzyme? HMG-CoA reductase inhibitor. These are the drugs of called atorvastatin, okay, rosuvastatin, atorvastatin, okay. So they inhibit which enzyme? HMG-CoA reductase, okay. If I'd ask HMG-CoA synthase, that is the rate limiting enzyme of the ketone body synthesis. What are the ketone bodies? You have acetone, acetoacetate, and beta hydroxybutyrate. So never get confused HMG-CoA reductase and HMG-CoA synthase. So how do I remember, guys? In a reductase there is a R, in a reductase there is a R, and in cholesterol synthesis there is R present. So R reductase and cholesterol, okay. Ketone bodies में synthase, ठीक है. He notes down the initial cholesterol level of 50 patients, okay. So a cardiologist wants to study the effect of this drug, and he measured the cholesterol levels of these 50 patients, and then he administers the drug on them, okay. After the month treatment, he measures the cholesterol level again, okay. Now what he's exactly doing, guys? He's testing a drug. He's taking the 50 patients having an increased cholesterol levels more than 200 or more than 250. So now he's checking the effect of this drug in the same population after the 50. Okay, it's checking the effect of the drug in the same patients after the 30 days. Okay, which of the following test or which of the following is the most appropriate test? The statistical significance of the change in the cholesterol level. So what are the following tests, guys? A very important question that they can ask in the exams. Very important question, guys, from the statistics and the test of significance. So to answer this question, guys, let's discuss first, okay, don't directly jump to the answer. Let's discuss first the test of significance. Test of significance. Very easy way I will tell you how to remember this test of significance, okay. So we have two types. We have two types of tests. We have parametric and non-parametric. क्या क्या हमारे पास, guys? We have parametric and we have non-parametric. We have parametric and we have non-parametric. Okay. If I talk about parametric tests, guys, we always take a quantitative data. कौन सा data लेंगे, guys? Quantitative data. Sir, now what exactly is this quantitative data? Okay, quantitative data is a data that can be measured. Quantitative data is a data that can be measured. Okay, in case of a non-parametric, we take qualitative data that cannot be measured. For example, examples of the both, guys. In quantitative data, for example, blood pressure can be measured. Are you getting my point, guys? Blood pressure can be measured. Cholesterol levels can be measured. Okay, hemoglobin can be measured. So that is a which type of data, guys? Quantitative data. Qualitative data where you cannot measure. For example, the blood group. Can you measure the blood group? No, sir. We can know the blood group. A positive, B positive, O negative, O positive. Na? You cannot measure. Can you measure? There is 3.5% of AB positive. There is a 8% of B positive. There is a 50% of O negative. No. So you cannot measure. Okay, nominal order that I have taught in the main classes of the PSM in a detailed way. So you just remember the shortcut how to answer these questions. Okay, so first of all, always whenever you answer these questions, first of all, check out what type of the data you have given. Is it a quantitative data or is it a qualitative data? What is a quantitative data? The data that can be measured. Blood pressure, cholesterol levels, hemoglobin levels. What is the qualitative data? That the data that cannot be measured. Okay, for example, type of anemia, for example, type of the blood group. Chalo. Now in quantitative data, guys, in a question they will mention that mean and standard deviation is checked. So mean and standard deviation for which type of data, guys? Quantitative data. And for this non-parametric, guys, percentage and proportion. Percentage and proportion will be checked, okay, in the qualitative data. Okay, now we have a test, parametric test of significance and non-parametric test. Okay, now we have a types of tests. We have parametric test and we have non-parametric test. If I talk about parametric test, guys, we have a student t test. Okay, first one we have student t test. We have student t test. Okay, in this student t test, guys, it's used for two groups. Used for two groups. It's used for two groups. Okay, now in this we have two types. Student t test, we have two types. We have paired student t test. We have paired student t test, and we have unpaired student t test, and we have unpaired student t test. You will understand every bit, guys, in a while. Understood? Unpaired student t test. Now you already know, guys, first step will be to check what is a type of a data. You got to know, guys, it is a quantitative data. You can measure the data. Then understand the question. Is in the question mentioned that we are comparing the two groups. Okay, if before and after intervention, before administration of the drug and after the results, if it's the same group, if you are comparing the same group, it's a paired student t test. Compare same group. कौन सा टेस्ट है, guys? It is a paired student t test. If compare two different groups, if compared two different groups, it is unpaired student t test. That will be unpaired student t test. Okay, so for the two groups, if before intervention, after intervention, it's the same group, your answer goes to paired student t test. Okay, if it is two different groups, your answer goes to unpaired student t test. And if more than two groups, my dear students, if more than two groups are given in the question, more than two groups are given in the question, then your answer goes to ANOVA test. Then your answer goes to ANOVA test. Then your answer goes to ANOVA test. Okay, so test of significance, first part, that is a parametric. Parametric is done for the data which is a quantitative data. In statistics, you have studied from your notes, guys, in the statistics type of the data. Then we have a nominal and ordinal scales as well. Okay, but for now you just remember, if we have a quantitative data, there can be three tests we can go for. We can go for paired student t test, we can go for unpaired student t test, or we can go for ANOVA test. What is student t test, guys? What is paired one? If before and after intervention you have a same group, that goes with the paired student t test. If you have two different groups you are comparing with, that goes with the unpaired. If more than two groups, you go with the ANOVA test. Okay, then the non-parametric test. Guys, we have a data which cannot be calculated. Okay, qualitative data in which we check the percentage and the proportion, guys. If there is a one paired group, you go with the sign test. Okay, more than two groups, chi-square test. More than two groups, you go with the chi-square test. Okay, so always rule out in the options when these tests are in the options given. Okay, rule out these options, because you know, first job in such questions. Now, did you understand the test of significance? Then I will show you the couple of questions on the same topic so that it will be fully cleared. Now, did you understand what exactly is a test of significance? The statistical tests, we call them. So parametric and non-parametric. First, the main part is you have to remember what exactly is the type of the data. What exactly is a type of a data? Is it quantitative and qualitative? Directly don't jump. First of all, differentiate qualitative, quantitative, then go with the groups. Okay, now the question is asking us that cholesterol level is checked. Is it a qualitative or quantitative data? Sir, it is a quantitative data. I can measure the cholesterol level. Okay, now when I'm saying that I can measure the cholesterol levels, that means you have to go for the parametric test. So chi-square is not a parametric test. So one option you already ruled out. Then it is between a same group. Okay, it says that after a month he measures the cholesterol level again. Okay, which of the following is the most appropriate? So 50 patients, he administered the drug, then checking the cholesterol level in the same 50 patients. Are you getting my point, guys? So this is the only between two groups. So ANOVA test is already ruled out. Now two groups, unpaired or paired. If a same group before and after intervention, you go with a pair T test, you go with a pair T test, and if different group, you go with a unpaired T test. Okay, now what will be the answer here? So it will be paired T test. Is it clear to everyone? Please tell me in the comment section. Is it clear to every one of you? Is it clear to every one of you guys how to approach such questions? है ना, HMG कोई reductase भी याद रखना guys, statins बायोकेमिस्ट्री में आए पूछेंगे यार. Is it clear guys? First of all you will check whether the data is a qualitative or a quantitative. पहले ये चेक करना है. उसके बाद the second step is what is question exactly asking. Is it a same group before and after intervention or a different group? If it's a same group, paired. If it's a different, unpaired. If more than two groups, ANOVA. And if same, it is a qualitative data that cannot be measured. For the one group guys, one paired group, you go with the sign test, and more than two groups, you go with the chi-square test. Is it clear? All of you? Yes, so clear. Okay, now faster answer me this question then. The test of significance done for two or more proportions. A test of significance done for two or more proportions. So what is the test you will do for one or more than one? Sorry, significant done for two or more than two. So I'm talking about a proportion. I'm talking about here proportion. ठीक है, so proportion में कौन से टेस्ट आ जाएंगे? नॉन पैरामेट्रिक टेस्ट, है ना गाइस? नॉन पैरामेट्रिक टेस्ट. व्हाट आर द नॉन पैरामेट्रिक टेस्ट गाइस? यू नो, चलो बता दो. व्हाट विल बी द आंसर गाइस? स्टूडेंट टी टेस्ट एज अ पैरामेट्रिक टेस्ट रूल्ड आउट. एनोवा टेस्ट पैरामेट्रिक टेस्ट रूल्ड आउट, है ना? सो व्हाट विल बी द आंसर हियर? More than two groups in a non-parametric test. When you check for the percentage and the proportions, first of all guys, proportion is the hint. So you check proportion in the non-parametric test, है ना? Non-parametric है तो ANOVA और chi-square चला ही गया. Your answer goes to the, sorry, ANOVA and student चला गया, and your answer will go to the which test guys? Chi-square test. Your answer will go to the chi-square test. Chi-square test. Is it clear? What will be the answer? Chi-square test. Chi-square test. Good. Chalo guys. All of you, one more question on this. One more question on this guys. Let me see. One more question on this. Chalo ye bata do. Everyone answer guys, all the people who are watching it. See. A blood pressure of three different groups A, B and C was measured and the mean blood pressure calculated out of it. The three means are different. The most appropriate test to determine the significance of the difference between mean is. What can be the test guys? What are the tests you will do? कौन से test करोगे? So first of all, identify the type of the data. Is it a qualitative data or a quantitative data? Second, what has been asked? Mean, standard deviation, percentage, proportion. Then type of the test you will go and the number of the groups. Step by step, है ना? Step by step. Answer guys. What will be the answer everyone? What will be your answer guys? Yes. What will be the answer, right? Good, guys. So first of all, blood pressure, it is a quantitative data. You can measure the blood pressure. Number first thing, guys. Okay, mean was asked in, that means parametric test. Okay, but here more than two groups. Okay, that means three groups are there, A, B and C. So more than two groups I've already discussed. Which test? ANOVA test. So your answer goes to ANOVA test. Okay, there is no other simplification of this topic. Okay, इससे simple हो ही नहीं सकता. You remember this much, guys? The main aim is to get the answer right. Okay, no matter how you understand it, indirectly, directly, है ना, किसी भी तरीके से you need to mark the right answer. चलो, next topic. If you want to check the incidence of deafness, if you want to check the incidence of deafness caused by the noise in the office workers and factory workers after 1 year. Okay, so epidemiological study I've already discussed, guys. I've told you that in epidemiological studies we form the first hypothesis, then we confirm this hypothesis by different studies like cohort study, case control study, cross-sectional study and ecological study. Okay, now when we confirm these hypotheses, sorry, when we analyze or test these hypotheses, we go for the following test. Okay, we go with the following tests and studies. So such type of studies that we are going to discuss, first one is a cohort study. Okay, cohort study. Okay, in part 1 I've already discussed, but let me tell you here a bit fast recap of this cohort study, guys. It is a forward looking study. It is a forward study. That means, what do I mean by forward study? That means it's a risk factor. That means it's a risk factor to disease study. It's a risk factor to disease study. For example here, guys. Okay, we are seeing that factory workers are being evaluated for what, guys? For deafness. Okay, guys, so it is saying that we'll see these factory workers who are working in the noise. What is the noise to them? So noise is a risk factor. Okay, noise is a risk factor and deafness will be the disease. So from risk factor to disease, the study, when we are doing such a study, is called as cohort study, which is also called as forward study. Why? Because we are going into the forward direction. For example, 2024, right now in the May, I'm starting a study on the people who are smokers. Okay, and I will evaluate these people for 10 years. So after 10 years I will check whether these people, whether these patients, or whether the group of people that I'm studying on, will they develop a lung cancer or not? Will they develop a lung cancer or not? Okay, now while I'm checking this from smoking to the lung cancer, that's a risk factor to the disease. Okay, such type of study, forward study, is called as cohort study, or it's also called as prospective study. क्या बोलते हैं इसको? और prospective study. And it's also called as cause to effect study. What is cause? Sir, cause is smoking. Effect क्या होगा? Lung cancer. Cause to effect study. Okay, now the parameters that we check in this cohort study, guys, we check relative risk, okay, attributable risk, population attributable risk. Okay, these are the parameters that we check in such type of study, and incidence as well. Okay, incidence as well. So these are the parameters. So incidence, relative risk, attributable risk, population attributable risk and incidence, they are checked in which type of study, guys? Cohort study. What is a cohort study? It's a forward looking study or a prospective study. Okay, when we go from risk factors to the disease, but this cohort study, guys, it's a time consuming study. Okay, and it is expensive study, because see, guys, you have to wait for a patient. Okay, you have to wait for a patient for 10 years unless and until you will get an outcome, you will get a disease. And in these 10 years, guys, continue follow-ups are needed. Okay, so follow-up is needed in which type of study, guys? Cohort study. Which type of study? Cohort study. But now we have one more type of a study called as case control study, which is an opposite to the cohort study. What is case control study, guys? That will be from disease to risk factor, from effect to cause. If it's forward, that will be backward. If it's prospective, that is a retrospective. And odds ratio is calculated in the case control study. What is the example? Patient is coming to you with the diagnosis of a lung cancer, or patient is coming to you with a diagnosis of a liver cancer. What will be your first question, guys? History of smoking or alcohol. Are you getting my point? So disease is already present there. Disease is already present there. So you're going back to the time, you're going in the past and asking a patient whether you had a history of smoking or alcohol. Are you getting my point, guys? So when we are going backward, when we are going back in time, such a study is called as case control study. Such a study is called as case control study. And what is the parameter that you check in that? Odds ratio. Okay, so for the detailed explanation, guys, I've already discussed that in, I think, in the PSM videos as well, uploaded on the same channel, or I think in FMG videos. So I've already discussed that, what exactly is in the detailed case control, what exactly is odds ratio, interpretation of the odds ratio, less than 1, equal to 1, or more than 1. So please go through your notes for that. But at FMG level, guys, they will simply ask define define a type of a study. Which type of study is that, and what can be the parameters that can be checked in that study? Okay, so forward will be a cohort study, backward will be a case control, at point if asked, that will be a cross-sectional or ecological study. At point will be a cross-sectional or ecology study. Is it clear, guys? Chalo. So incidence is checked in which type of study? Cohort study. And one more, guys, here it was said that after 1 year, so we are going in a future forward direction, after 1 year you are going to check that what will be the outcome, that is called as cohort study. And that's why it's also called as cause to effect study, cause to outcome study. So that is cohort study. I think I've discussed here cohort before, that's why I didn't go for a detailed explanation. Let me check out if it is there. Yes, guys, I've already discussed here case control and cohort study in the part 1. So case control and cohort. Case control, it's backward study, retrospective study, it's outcome to exposure. Outcome is already cancer there, and you are going to the exposure, whether you are exposed to the smoking or alcohol. It's a very fast study. Why it's a very fast study, guys? Because no follow-ups are needed. But here it's a slow study. Why? Follow-up is needed. And strength of association is given by parameters: relative risk, attributable risk, population attributable risk, and incidence. And here strength of association is given by odds ratio. So whenever in a question you are seeing odds ratio is given, you probably take it in through as a case control study. It's a fast study, no follow-up is needed. Okay, and also it is cheaper than the cohort study. Why? Because for the follow-up you need to go for particular tests, investigations. For that, of course, you need a money, time consuming. So that's why no follow-up needed, and it's a very fast study. Is it clear, guys? Cohort and case control. So here, if I show you this question, guys, a study was conducted, 500 patients having a carcinoma lung. So patient coming with a carcinoma lung, and another group 300 was chosen from the general population. Both these were questioned to the exposure to the smoking. So you're going back in the time. Are you getting my point? They have a disease present, but you are going backward to the time and asking them whether you have exposure to the smoking or not. And such type of study is called as case control study. Strength of association for the cross-sectional, guys, what do we check in the cross-sectional? Prevalence of disease. Prevalence of disease. Okay, and ecological study, it tells us about a characteristic of the population. Remember, unit of study for cohort, cross, and case, CCC, unit of study is individual, while as a unit of study for ecological study is population. Okay, so cohort study in a very fast way. Cohort study is a forward study, forward direction. Case control, backward direction. Cross and ecological at point. Point number 1. Point number 2, guys, that the unit of study in cohort, cross, and case is for individual, while as in ecological, it tells us about a characteristic of the population. The unit of the study is population. Okay, the strength of association in cohort study, you check incidence, exposed upon non-exposed. Incidence, you check for relative risk, you check for attributable risk and population attributable risk. In case control, strength of association with the odds ratio. Cross section mein prevalence, and ecology will tell us about the characteristic of population. The best study among all will be your best study among all. In the comment section, write down the best study. कौन सी है? Which one is the best study? Which of the following study is the best study among all? I'll give a hint, it's not from these four. That is a combination of all the studies. That is a combination of all the studies, bacho. That is a combination of all the studies. What will be your answer for that? That will be meta-analysis. ठीक है, चलो. So case control again, guys, done. It's observational. It exactly started from the epidemiological classification studies, observational and experimental. Experimental, I've already told you, है ना, clinical trials phases. But observation में first you have to make the hypothesis with the time, place and person, है ना. Then we study about a particular disease. Chalo guys, next question. Very important, repeatedly asked, that a woman with the age group, a woman in the age group of 25 to 45-year-old ladies there, she's 10th pass, she's married or divorced. She belongs to the same village and she has well communication skills. Sir, आपके all video मिल सकते हैं क्या? Okay, not possible all the videos, but whatever YouTube sessions I'm going on with, guys, you can watch them. Right, whatever YouTube sessions, and rest, guys, you can join the channel FMG with Dr. Talib, and most of MCQs I'm posting there, so that is useful. Okay, but yes, sessions, whatever sessions I'll be taking on the YouTube from the FMG and Meduhub, you guys can watch. Chalo guys, our main goal is pass the exam, है ना. 150 par कर लो, then let's see further what will happen in the PG. But right now, guys, our main goal is to pass the exam. Chalo. So you have a woman 25 to 45-year-old. She's a 10th pass. She's married, well communication skills, same village, selected by a village personnel. She is eligible to work as. She is eligible to work as. Very good. She is eligible to work as ASHA. So what is the full form of ASHA? Accredited Social Health Activist. Accredited Social Health Activist. Yes. Exam tak aap subject please teach. Yes. Till exam I teach multiple subjects. I teach 4 to 5 subjects, guys. But yes, I hope next week I'll come with the pathology general. So we'll have a general path. OB-GYN discussion we're already doing, guys. Okay, high discussion OB-GYN ma'am one is taking. So OB-GYN discussion, PSM topics are also coming. So next discussion we're gonna talk about general path. Chalo. So that will be seen later. Let's focus on the session for now. So accredited social health activist. Okay, now let's discuss about this ASHA. Okay, so if we talk about the village workers, what are the village workers? This was again question asked, which of the following is not a village worker? 3 options from this and 1 A&M was given. Are you getting my point? Chalo. Remember guys, village worker is ASHA, accredited social health activist. AWW, that is Anganwadi worker. TBA, traditional birth attendant, and VHG, village health guide. Okay, these are all what? These are grassroots level workers or the village workers. Okay, after that, guys, if I talk about one by one about a traditional birth attendant, village health guide, ASHA and AWW. Okay, let's talk about the location first. TBA. Okay, the location is at which level, guys? She's at village level. She's at village level. Population, guys, she's one per village. 1 per village. Education, guys, not required. Education not required. Okay, training duration, guys, 30 days. The training duration, how many days? 30 days. And she's trained by multi-purpose worker female and medical officer. And she's trained by multi-purpose worker female and medical officer. Okay, that's about a traditional birth attendant. Okay, if I talk about village health guide, guys, she's working at which level? Village level. Okay, she's 1 per 1,000. She's 1 per 1,000. Okay, after that, guys, education, it's 6th pass. Education, it's 6th pass. Okay, training duration, it should be 200 hours training, or it should be 3 months. 200 hours or 3 months. And if I talk about training, it's trained by medical officer. Who is training, guys? Medical officer. Okay, very important one, guys, ASHA. Okay, very important one among all, ASHA. So ASHA, it is at a village level. Before it was 1 per 1000, but it's now 2 per 1000. वर्ल्ड डिबेट हुआ था इस बात पे. Then guys, 8th pass was the education first, now it's 10th pass. Then the training should be how many days, guys? It should be 23 days. Training should be 23 days. Training should be 20, and it's trained by Anganwadi worker. She's trained by multi-purpose worker female, and she's trained by medical officer, MO, medical officer. कुछ और नहीं याद रखना है. I'm telling MO, medical officer, because after the session is completed, you make your own MO का कुछ भी बना दोगे, है ना, माइलोपेरोक्साइड, ऐसा कुछ नहीं है, ठीक है. AWW गाइस, ओके, इट इज एट द ICDS सेंटर, आंगनवाड़ी सेंटर्स में होती है, आंगनवाड़ी वर्कर, ओके. एंड इफ I talk about plains, it's 1 per 400 to 800 in plains. And if I talk about hills, it's 1 per 300 to 800 on mountains. Okay. Then guys, education you need should be 12th pass. Okay. Training duration should be 4 months. And who is training this? Project officer. So that is all about the village health workers. Are you getting my point? Whether that's a traditional birth attendant, village health guide, ASHA, or AWW. Who gave the concept of village health guide? Just now we studied, guys, Rome and village health guide concept. Srivastav committee. Okay. Now let me add on a bit about ASHA, guys. What is the criteria of ASHA? ASHA का criteria पढ़ते हैं थोड़ा सा. चलो, remember it, guys. Okay. In criteria of the ASHA, guys, she should be female, 25 to 45 years old. Female, 25 to 45 years old. She should be same village resident. Okay, it's not like she will come from the Andhra Pradesh and wants to be an ASHA in the Kashmir. ऐसा नहीं चलेगा, है ना. She should be from the same village, because she should have a good communication skills, and she should know everyone in the village, okay, who is pregnant, and she has to enter all the details, and she should be good with everyone, not like attituded person. Patient will be pregnant in the community and she will not even go to look and register them. Chalo. Same village resident. She should have good communication skills. She should be now 10th pass. Okay, she should be 10th pass. Okay, whether married or divorced. Okay, what is the function of ASHA? काम क्या करना है इसको? Home delivery of contraception. Home delivery of contraception. Like, what are the government contraceptions? Like estrogen plus progesterone pills, Mala and Mala D, where we have ethinyl estradiol and levonorgestrel. Okay, like male condoms. Okay, she has to advise awareness of using sanitary pads in the females who are bleeding menses. So she has to deliver all these things. Okay, she's a part of JSY scheme, Janani Suraksha Yojana, JSY. She's a part of JSY, and she goes for a active disease surveillance. Now, what is her active disease surveillance? Now, this active disease surveillance, we have a types of surveillance, guys. We have a active disease surveillance, we have a passive disease surveillance, and we have a sentinel surveillance. In active disease surveillance, a hospital member or a ASHA, a medical worker, is going to house by house. He's going every house by house, and giving a treatment to the patients, taking investigations from the patients. In passive surveillance, guys, a diseased person is coming to the hospital. For example, a patient has any communicable disease, cough, cold, fever, so he's coming to the hospital and taking the treatment. That is a passive surveillance. But if the hospital person is going door to door for investigations and giving the treatment, that is an active surveillance. And ASHA is for active disease surveillance for which conditions, guys? Remember, tuberculosis के लिए जाते हैं, leishmaniasis and filariasis. Leishmaniasis and filariasis, है ना? Leishmaniasis and filariasis. quick review about these three conditions, guys. Verbally, I'm not writing that. Remember my every word. है ना? Leishmaniasis में काला अज़र drug of choice is amphotericin B. है ना? Then leishmaniasis, it can be visceral leishmaniasis, cutaneous leishmaniasis, depending upon whether it's L. tropica or L. brazilians. Okay, the test that is done is RK39 dipstick test. Okay, and remember there are LD bodies, Leishmania Donovani bodies. At least remember this much for the leishmaniasis, and the drug of choice I've already told you. Filariasis, guys, it can be caused by the Wucheria bancrofti or Brugia malai. Number one thing. Number second thing, the test that we do for the filariasis, we take the smear, one thick smear in the night time. Remember this. Point number third, guys, that filariasis, the test name is membrane filtration test. The test for filariasis is membrane filtration test. Point number four, there is a triple drug therapy for the filariasis, that is aid. अब AIDS नहीं लिख देना, aid. That is albendazole, ivermectin, and diethyl carbamazine. Okay, if one drug to give and choose the answer, particular drug, you will use DEC, but exactly we use three drugs: albendazole, ivermectin, and diethyl carbamazine. Okay, one more point I've already mentioned with you guys, how to differentiate from the micro question aega, how to differentiate Brugia malai and Wucheria bancrofti, guys. Wucheria bancrofti, there is no nuclei at tip. This is a classical picture of the filariasis. Number one thing. Number second thing is, guys, there is a no nucleus present at the tip of Wucheria bancrofti, but Brugia malai B, 2 number. So 2 nucleus are present in the tip. Okay, so how to differentiate these things? Okay, this can be the question asked. And already, guys, thick smear will be given. Membrane filtration test है ना, Wucheria bancrofti malai, 3 drugs: albendazole, ivermectin, and diethyl carbamazine. और यहाँ पे क्या है? LD bodies, I've already told you. Donovani for the visceral, L. tropica for the cutaneous leishmaniasis, and one more thing, guys, RK39 dipstick test. And who is taking, guys? Asha. See, in the question already I've hint, Asha is going for the active surveillance, and this much, guys. And Bihar, West Bengal, more commonly seen these things. Okay, so this was all about these two things. Okay, so verbally I've said, remember all these things, guys. They all are important questions. If I'm focusing on some part, I'm dragging it more, that means that is an important question. Kala azar and leishmaniasis and filariasis. And a micro wala, remember the tips. If there is no nuclei at the tip, that's Wucheria bancrofti. But if there is a tip, nucleus in the tip, that is Brugia malai. वो आपका Brugia malai है. चलो, guys. Now demographic cycle, guys, in India currently. So it's clear, guys. Asha, 25 to 45-year-old lady, 25 to 35-year-old lady, guys. The 45, village, same resident, good communication skills. Okay, 2 per 1000, 10th pass, training is 23 days. That is accredited social health activist, Asha. Okay, function, she's a part of GSY, home delivery of the contraceptions, and active disease surveillance for TB, leishmaniasis, and filariasis. Is it clear to everyone? Write down in the comment section, guys. Clear to everyone? Is it clear to everyone? All of you? Yes. Before starting the next topic, guys, tell me first, is it clear to everyone? Yes. Chalo, guys, perfect. Perfect, that's great that you guys are understanding every point. Chalo, guys, in which stage of the demographic cycle is India currently? So let's understand the phases of this demographic cycle, guys, first, and then answer the question. Okay, now we have mainly 4 phases, guys. We have high stationary phase, we have early expansion, we have late expansion, and we have low stationary phase. Okay, what does stationary mean, guys? At point, change nahi ho raha hai. So already, guys, population size will be stationary, neither increase or decrease in case of a stationary, whether it's high stationary or low stationary. If I talk about high stationary, that is a phase 1. The birth rate is very high. The birth rate is very high, and death rate as well is very high. So birth rate is high, death rate is high, the population size will be stationary. The population size will be stationary. If I talk about early expansion, okay, the birth rate is very high. The birth rate is very high, and the death rate, guys, it starts declining. And death rate, it starts declining. And what will happen to the population size? It will start increasing. It will start increasing. Then the late expansion, the birth rate declines, okay, and death rate continue decline. And what will happen to the population size, guys? It will increase but slowly. Then, guys, birth rate will be very low. Death rate, guys, low. Both of low, guys. Population will be stationary. Population will be stationary. Okay. Then the reversal, guys. Birth rate is 0. No babies born, guys. Death, it will be natural deaths. Reversal mein natural deaths will take place, and population size will decrease. So that is the phases of a demographic cycle. And in India, we are in the stage 3, that is late expansion. Okay, so India is in late expanding stage. India is in which stage? Late expanding stage. Is it clear, guys? Late expanding. So demographic cycle, remember, guys, if stationary, high stationary, low stationary, population will be stationary. And India, the birth rates are declining now, okay, and death rates continue to decline, and we are having population increase slow rate. Is it clear? So answer, demographic cycle, it's late expanding stage, है ना? So census, you already know, census is done after how many years? Census is done after every 10 years. Last census कब हुआ था? 2011. census के बारे में, okay. Then sample registration system, SRS हम करते हैं, that gives us data every 6 months. Every 6 months SRS. Okay, first census was done in, पहला कब किया था? 1981 में. चलो guys, and who is conducting this census? Ministry of Home Affairs. Ministry of Home Affairs. Okay, that is a bit extra point, guys. So main is demographic cycle, late expanding stage. Late expanding stage. Okay, let's move to the next question, guys. We've already discussed, guys, A, B, C. Mean was there, quantitative data was there, more than 3 groups, more than 2 groups, your test is ANOVA test. Okay, paired is a test when before intervention and after intervention is the same group. पेयर टी टेस्ट फॉर क्वांटिटेटिव डेटा, काई स्क्वायर फॉर नॉन पैरामीट्रिक टेस्ट क्वालिटेटिव डेटा है जहाँ पे मोर देन 2 ग्रुप्स होगा, एंड स्टूडेंट टी वी हैव टाइप्स पेयर्ड एंड अनपेयर्ड. चलो, now in a train accident there were 74 dead, 4 were severely injured, 15 moderately injured, and 22 mildly injured. The color coding in the triage from highest to lowest category is, okay. So remember, guys, triage. Let's discuss this triage. Okay, what is triage, guys? Segregation of the patients, okay, on the basis of the chances of survival. Okay, so we have a categories over there, okay, and along with categories we will give them the priority. If I talk about red one, guys, they are given highest priority. The red are given highest priority, okay, and those who need a life-saving surgery, those who need life-saving surgery, okay, that means a surgery within 0 to 6 hours, within 0 to 6 hours, okay. After that, guys, yellow, उसके बाद yellow given a medium priority, given a medium priority, yellow. After that, guys, green, low priority. These are the ambulatory patients. And last one guys, black, that are having least priority, giving least priority. Okay, dead or morbid patients. Dead or morbid patients. So what is the order guys? It's red, yellow, green and black. Okay, it's red, yellow, green and black from the highest to lowest. Red, yellow, green and black. Okay, within 0 to 6 hours, 0 to 6 hours guys, 0 to 6 hours, how do you remember? 0 to 6 hours red. If yellow hours guys, within 6 to 24 hours. Okay, 6 to 24 hours for the yellow. Low priority for the ambulatory patient, green color, and black, least dead or morbid. So RYGB, remember that, easy one. Which of the following does not show a iceberg phenomena? Which of the following does not show a iceberg phenomena? What is iceberg phenomena guys? Let's discuss. The visible part of the iceberg are the clinically diagnosed cases, and the hidden one is having a asymptomatic cases or pre-symptomatic or undiagnosed or deliberately ignored. Those are submerged part that is here will go with the hidden cases, and visible part over here my dear students, that is a diagnosed cases. So diagnosed and undiagnosed. And this water, surrounding water, remember that surrounding water is a healthy population, and surrounding water indicates healthy population. Surrounding water में क्या होता है? Healthy population. And this line is a apparent line. It's a demarcation line between apparent and non-apparent cases. This is a demarcation line. Demarcation line. Is it clear? After that my dear students, now disease that show this phenomena. Okay, what are the disease that show? HIV, malaria, okay, typhoid, polio and diphtheria. And disease that does not show guys, rabies, rubella, tetanus, pertussis and measles. So which of the following does not show? Okay, HIV show. Which of the following does not show? Yes, HIV shows, malaria shows, typhoid shows, so rabies is the answer. Rabies is the answer guys. So diseases showing the iceberg phenomena or not showing the iceberg phenomena. Is it clear guys? है ना? So remember guys, HIV, malaria, typhoid, polio and diphtheria, they show, and does not show rabies, measles, tetanus, pertussis and rubella. Okay, some books write rabies, rubella, some don't write. You just remember, okay, whatever I said. Chalo, choose the incorrect statement in the given below for the vaccine strains. Okay, so if we talk about the strains of vaccine guys, fast we'll have to complete this. If we talk about the strains of vaccine, if first one guys, BCG vaccine, the BCG vaccine, the name of the strain is Danish 1331. It's Danish 1331. Okay, if I talk about the yellow fever, if I talk about a yellow fever, the name of the strain is 17D. Yellow fever के लिए it is 17D. Okay, one question was asked about a yellow fever vaccination, that the certificate of the yellow fever vaccination is valid after how many days of administration? कितने दिन बाद guys? After 10 days. After 10 days. मैं यहाँ पे hint लिख रहा हूँ 10 days, तो याद रखना guys. Just remember 10 days. Okay, the certification is valid. Okay, after 10 days. Okay, it's valid after 10 days till the lifelong. Okay. After that guys, Japanese encephalitis. If I talk about Japanese encephalitis, if we have a live के लिए, what is the name of the strain? SA14142. If I talk about killed के लिए, you have Nakayama. Name of the strain is Nakayama. Okay. If I talk about rota, अगर रोटा की बात की जाए guys, it's RIX4414. Okay. If I talk about influenza, for influenza guys, it's A72009 caliph. If I talk about measles, it's Edmonster Zagreb. If I talk about mumps, okay, with the complications of orchids, it's Geraldine. If I talk about chickenpox, that's Oka strain. Chickenpox is Oka strain. If I talk about rubella, that's RA273. That's RA273. So name of the strains of vaccine guys, remember guys, it's Japanese encephalitis here. So BCG Danish 1331 guys, it's right. Okay, yellow fever is 70D, it's right. Measles is Edmonster Zagreb, it's right. Rubella is not Oka. Okay guys, Oka is for, my dear student, Oka is for, sir, it's for chickenpox. It's for chickenpox or varicella zoster. One and the same thing है ना. And my dear students, for rubella, क्या है हमारा rubella के लिए, it's 27.3. It's RA273. It's RA273. Is it clear guys? So rubella is Oka. Chalo, all of the following constitutes demographic process except, all of the following constitutes demographic process except. So we have 5 demographic processes. We have 5 demographic processes. Number 1 is mortality. Study of a population is demography. Okay, what is demography? Study of a population. So 1 is mortality, how many people are dying. Marriage, we have migration, okay, we have social mobility, and my dear students, the last one goes with the fertility. So 5 demographic processes. We have mortality, marriage, migration, social mobility, and fertility. Okay, remember guys, morbidity is not, okay, morbidity disease person hai na, that is not a demographic process. So we have fertility, migration, social mobility, mortality, and migration. Is it clear guys? So what are the indicators of demography? Remember now the indicators of demography. Indicators of demography. We have crude birth rate, we have crude death rate, we have general fertility rate, we have total fertility rate guys, okay, we have girl child reproductive rate, I will tell you this, and we have NRR. Are you getting my point guys? And denominator most of the times we have upon mid-year population है ना, mid-year population which is taken on. Mid-year population कब ली जाती है? 1st July. That was again an FMG equation, 1st July. Now let me tell you exactly guys, ये mid-year demography from the main workbook. Just yeah. So demography guys, 5 processes. Demography is a study of human population guys, remember. And we have mortality, we have marriage, we have fertility, we have migration and social mobility. I've already mentioned here guys, morbidity is not included. I've already mentioned morbidity is not included, point number 1. Now guys, indicators of this demography guys, we have crude birth rate, that is number of live births by mid-year population. Mid-year population कब ली जाती है? 1st of July. कब ली जाती है? 1st of July. Again a question guys, multiplied by 1000. If I talk about crude death rate, number of deaths, mid-year population 1000. General fertility rate, total number of live births upon total mid-year population of reproductive age, that is 15 to 49. GMFR, general marital fertility rate, it's a total number of live births upon total mid-year population of the married reproductive age. Question was, TFR asks that the total number of live children born to a woman in her entire reproductive age. It is TFR. That was the question asked, a PYQ, guys. Then in GRR, gross reproduction rate. If GRR is there, GRR, G for gross, G for girls. So total number of girl children born to alive to a lady here in her entire reproductive, that is gross reproduction, and total number of girl children remaining alive till their own reproduction, that is NRR. And the question was, only demographic indicator which includes mortality, are you getting my point, guys? It's NRR. And most important among all is net reproductive rate. It's net reproductive rate. Is it clear, guys? And the current value of as per the sample registration system, current value of the CBR, it's 19.5, and CDR it's 6.0. okay, goal for TFR is 3, goal for GRR is 2, and goal for NRR is 1. okay, that's all about indicators of demography and 5 demography process. I've already mentioned here question, no morbidity, है ना? They will ask that which of the following is not included in the demographic process. Is it clear, guys? है ना? Yes, they can ask a calculation question, guys. You have to remember. Okay, before now, the first time, last time, they have already installed the calculator in the exam paper. So there is an option of a calculator, so you can solve. You have to remember the formulas now. Chalo. Further. Okay, phases. This is a demographic transition model, guys. One exam I remember, this picture was given and it was asked what is this. This is a demographic transition model, है ना? demographic cycle भी दिया था, वो नहीं है, ठीक है? demographic transition model. चलो, census I've already told you, guys. Sample registration system एक बार फिर से सुन लो, guys. Civil registration system, it's also known as vital registration system. You have to register a death and a birth within 21 days or the 3 weeks. Okay, you have to marriage, you have to within 60 days. Delivery outside the India within 60 days of the arrival. Okay, every 6 months SRS, and parameters are birth rate, death rate, and infant mortality rate. है ना? So this was about a demography. Is it clear, guys? है ना? A bit faster, but yes. Chalo. Coming back to our own topic. The Alma Ata Conference 1978 was conducted, okay, with a theme to discuss on the primary and essential healthcare of a country. All of the following are the principles of primary healthcare. Principles of primary healthcare except. Okay, so you have to remember the principles of the primary healthcare. We have 4 principles. कितने हैं, guys? 4 है. Number first thing you will remember, guys, equitable distribution. Equitable distribution. Then community participation. You have community participation. Then, my dear students, you have intersectional coordination. You have intersectional coordination and appropriate technology. Appropriate technology and appropriate technology. Okay, so these are principles of primary healthcare. So among which of the following is not a principle? So community participation is there, guys, intersectoral coordination is there, equitable distribution is there. Okay, but which among the following is not there, guys? Appropriate policy is not there. It's appropriate technology. Okay, it is appropriate technology. Appropriate technology. Okay, remember one thing, guys, sometimes they will mention what? Sometimes they will mention an option as, I've seen this multiple times, they will mention inappropriate technology as well. So remember, it's not inappropriate technology. So if in options you will see, so remember, guys, it is not in the principle. So 4 principles we have: equitable distribution, we have intersectional coordination, we have community participation, and we have appropriate technology. What are the elements, guys? Remember the elements fast. E for health education. E for health education. L for locally endemic disease. L for E for essential drugs. E for essential drugs. M for mother and child care. Mother and child care. I for immunization. N for nutrition. T for treatment of common diseases. And S for safe water supply and sanitation. Safe water supply and sanitation. So these are the elements. Okay, and here answer was appropriate technology. So remember the elements of primary healthcare and the principles of primary healthcare. Okay, a case control study. Okay, a case control study is a type of an observational study in which two existing groups differ in the outcome are identified and compared on the basis of some supposed causal attribute. All of the following are the advantages of case control studies, except all of the following are the advantages of the case control study. Okay, now I've already discussed, guys, that odds ratio, okay, useful in rare disease, it's case control. Odds ratio, case control. Cheaper study and a fast study, it is case control. Relative risk is not calculated, my dear students. Okay, I've already discussed that relative risk, population attributable risk, they are the parameters, strength of association for what? Cohort study. Okay, if you remember, guys, see over here I've already shown you guys, we have already discussed about that for case control study and cross sectional study, if we go for the difference between them, guys, the relative risk RR, the relative risk, it is seen in which type of study? Cohort study. कहाँ पे दिखता है? Cohort study में. Okay, now let's discuss these all studies in this one. यहाँ पे एक पॉइंट पे ना इनको सबको डिस्कस करते हैं यहाँ पे. चलो fast. Okay, now first of all, guys, if I talk about a direction of the cohort study, what is the direction, my dear students? That the direction is forward. The direction is forward. In case control, the direction is backward. The direction is backward. In cross sectional, it's at point. The cross sectional, it's at point. And ecological study, also at point. Also at point. Okay, if we talk about importance, guys, among these four, followed by this, followed by this, followed by this. If I talk about unit of study, I've already told you individual, and here study of the unit is population. Here the unit of study is population. Okay, the parameters, what are the parameters or the strength of association is checked by? Important, ये रखना याद. Remember this, guys, no matter what, you check incidence, you check a relative risk, you check attributable risk and population attributable risk, all in which study, guys? Cohort study. You check odds ratio, you check odds ratio in case control study. You check cross sectional में क्या चेक करोगे? Prevalence of disease, odds ratio. And ecological will tell me about a population characteristic. Ecology will tell me about a population characteristic. Okay, that's all about a epidemiological studies. ठीक है, guys, is it clear? I hope it's clear, guys. We'll discuss very much epidemiology, है ना? इतना याद रखो गाइज, इट्स दिस important table. Important table. Let's move to the next topic, guys. Already discussed. Yes, I was told you already. A 3-year-old baby was brought to the hospital with the complaints of fever and severe diarrhea, abdominal pain, and vomiting. है ना? On the history taking, mother revealed that the child was vaccinated recently. So the child had a recent vaccination. On examination, reveals a sausage-shaped lump on palpitation. So there was a sausage-shaped lump present on the palpitation. Which vaccine was given to the child, which has led to these adverse effects? So which vaccine was given, my dear students? So first of all, remember the adverse effect of the vaccine. Okay. So what is your diagnosis, guys? Sausage-shaped lump. Diagnosis क्या है? I've already mentioned over there. Diagnosis is, sir, interception. Your diagnosis is interception. Okay. And a classical finding of which stools, guys? Red color jelly stools. Sign, we have target sign. वो तो तुम्हें that you know more than me. चलो अभी इतना देख लो. Adverse events following the immunization, guys. The ideal observation after the immunization, you have 30 minutes. You have to check the patient, guys, whether there can be side effects. But I will mention some. Yes, you are right. All you are right, guys. Most of you are right. C is the right answer. But let's discuss other vaccines and their side effect. If I talk about paralysis, that goes with which vaccine side effect, guys? Oral polio vaccine, OPV. Hypersensitivity reaction and shock with hepatitis B. If I talk about toxic shock syndrome, measles. Toxic shock syndrome is caused by Staph aureus. याद रखना Staph aureus है ना. Which contraceptive gives the toxic shock syndrome as a complication or a side effect? Vaginal diaphragms or sponge. ठीक है ना, vaginal diaphragms. Douche cap. Guillain-Barré syndrome with killed influenza. Interception with the rota. Febrile seizures with measles. Persistent crying with the pertussis. वैक्सीन लिख रहा हूँ साथ में. Thrombocytopenia with MMR. Neurological complications with DPT, diphtheria, pertussis, tetanus, and miliary TB is a side effect of which vaccine, guys? BCG vaccine. So here, guys, a sausage-shaped lump interception was diagnosed, and your answer goes to rotavirus vaccine. So remember these all the adverse effect of the vaccines, please remember. Okay, now further next question, guys. The third generation IUCD, guys, very simple question. Your third generation IUCD is a hormonal intrauterine contraceptive device having a hormone levonorgestrel, that is Mirena. So let's discuss all the generation of the intrauterine copper devices, guys. So we have first generation, we have second generation, we have third generation, and my dear student, we have fourth generation. Okay, the examples of a first generation, we have Lippel's loop. First generation, we have Lippel's loop or Grafenberg ring. Lippel's loop or Grafenberg ring. The second generation, my dear students, we have copper T380A and copper T200 and copper T200. The third generation, we have hormonal containing, we have Mirena. Okay, which hormone is there, guys? LNG. Okay, remember about second generation, they are copper containing. Third generation, they are hormonal. Hormones are there. कौन सा hormone? I've already mentioned that it's LNG. And the fourth generation, we have Flexigard. And fourth generation, we have Flexigard. If I talk about mechanism of action, guys, the old days we used to have Lippel's loop, and it was said that, okay, it was not fully proven, but books write that mechanism of action is by the aseptic inflammation, है ना. Inflammation में क्या होता है, guys? Migration, rolling, additions, and at the end macrophage eat that particular WBC, है ना. तो क्या होता है but in this condition, guys, aseptic inflammation was occurring without an infection, है ना. तो क्या होता था, that macrophages are eating this sperm. It was said that macrophages eat this sperm, so it prevents the fertilization, है ना. aseptic inflammation, septic होता तो बीमार होता है ना, aseptic इसीलिए लिखा मैंने. चलो second generation guys, copper containing, they prevent fertilization, they prevent fertilization. Okay, the third generation guys, they inhibit ovulation, they inhibit ovulation. And what will they do guys? And make cervical mucus thick, and they will make cervical mucus thick. And my dear students, when the cervical mucus is thick, what will happen when there is a thick cervical mucus? It will be difficult for a sperm to travel in the thick cervical mucus. That's why LNG, levonorgestrel, if you have studied in your pharmacology, are generations of the progesterone, है ना. levonorgestrel is a type of a progesterone. तो क्या करेगा? एंडोमेट्रियम सर्वाइकल म्यूकस को थिक बनाएगा. What is the function of an progesterone in a secretory phase? It makes endometrium thick, it makes endometrium secretory, है ना. Estrogen क्या कराता है? Proliferation कराता है ना. I've already discussed that in OB-GYN. So when you are giving progesterone, it's making the cervical mucus thick, and there is a difficulty for a sperm to travel in a thick medium, है ना. That's why on drying there is no ferning pattern on the, there is loss of ferning pattern on drying the progesterone secretion, thick cervical mucus. But if there is a estrogen that is thin, so there is a fern pattern, there is a fern pattern. Spin bucket stretchability test. So fern test is due to the estrogen, thin hota hai, that's why there is a ferning pattern, है ना. And over there that is a thick. And FlexiGuard guys, it works by prevent fertilization. It also prevents fertilization. It also prevents fertilization. It also prevents fertilization. Is it clear? Is this clear guys? Mechanism of action. So this was all about. So here guys, Mirena, what is the lifespan of the Mirena guys? 5 to 7 years, है ना. Copper T 200 guys, it's a second generation. We have also second generation as copper T 380A. The question was asked, what is the lifespan of copper T3? It is 10 years. Okay, I'll show you the pictures of this devices, contraceptions. Chalo. Okay, this is a female condom guys with the 2 rings. Male condom, sorry, this is a male condom with a 1 ring. Here it's a diaphragm or dish cap with a complication of a toxic shock syndrome, है ना. कौन कराता है वो? स्टाफ ऑरियस. यहाँ पे भी लिख देता हूँ स्टाफ ऑरियस. And how to insert? 4 to 6 hours prior to the intercourse and take out 4 to 6 hours after the intercourse. This is a foam tablet vaginal sponge. Today the question 2022 June was asked, what is inside this tablet guys? 1000 mg non-oxynol 9. What is that non-oxynol 9? So it's a spermicidal gel. Okay, and then this one, it's a Mirena. Okay, third generation intrauterine copper device with a lifespan of 5 to 7 years. This one guys, this is a copper T380A with a lifespan of 10 years. And the second generation, this one, it's a Lippel's loop with a first generation ICD with a mechanism of action of aseptic inflammation. So it is all about the contraception. Okay, any other pictures? This was the distribution of this particular drug, Mala N and Mala D, that was talking about. It has estrogen plus, this is progesterone and this is estrogen, है ना. Estrogen plus combined OCP's drugs. Okay, Mala N and Mala D. ठीक है ना guys? चलो. Any other? This is a Saheli guys, and having a selective estrogen receptor modulator there. Which one? Ornithoflexine. याद रख लेना. This is Antara guys. Contraceptive image I'm showing. It contains depot medroxyprogesterone acetate, again a progesterone, but the side effect is irregular cycle. And this is the same depot medroxyprogesterone acetate that you use in the endometriosis for the atrophy of the endometrium as well. Or koi image in the contraception? No, no other image in the contraception. Is it clear guys? Chalo. Okay, all good. That's most about in this discussion guys. That's so much that we can remember. Okay, in disaster management all are true except yellow color is medium priority. Yes. Gastroenteritis is the most common infection after the disaster. Yes, gastroenteritis is the most. That's why the first thing you have to do after the disaster, try to availability of the drinking water should be there, है ना. And which vitamin is deficient after the disaster? Vitamin A deficiency. ये भी रखना याद. All given options are true. Okay, or response in pre-disaster phase. So answer is response in pre-disaster phase. No, response is in which disaster phase? So that is in post-disaster phase. Now let's discuss that disaster phase. Okay, now let's discuss this faster guys. So disaster cycle guys, we have prevention, we have preparedness. Okay, first of all you will have a prevention from the disaster, है ना? Then you will be prepared for the disaster. After disaster is happening, it's before the event, pre-disaster, post-disaster, there will be a response and recovery from that. Okay, in case of a prevention, okay, what you will do, risk assessment and planning and pre-disaster activities you will do. But after that guys, response में क्या करोगे, emergency management, you will try to give manage the patients, and then recovery में you will build the infrastructure and reconstruction of the buildings. Are you getting my point? So disaster we have pre-disaster and post-disaster. The pre-disaster guys, okay, pre-disaster में क्या होता है, पहले mitigation or the leading preparedness, which is called leading preparedness. Okay, post disaster guys, response. Post disaster there will be response and rehabilitation. Rehabilitation. Okay, it is under the Ministry of Home Affairs. It is under the Ministry of Home Affairs. Okay, and NDMA is looking after National Disaster Management Authority. National Disaster Management Authority, and the chairperson is Prime Minister, and the chairperson is Prime Minister. Okay, so that was all about. So response is in which phase guys? Response आता है post disaster में, after the event, not in a pre disaster. Chalo guys, a 26-year-old male present with a fever, chills. Okay, very important. Presented with a fever, chills, night sweats and diarrhea. The physician is suspecting malaria and she sent a blood sample for the diagnosis, and dipstick was performed for the rapid diagnosis of Plasmodium falciparum. The rapid diagnosis is based upon which protein? Okay, multiple times I have discussed, it depends on, it's a NEET PG PYQ, it depends upon a histidine rich protein. Okay, so let's understand about a diagnosis of malaria, how we diagnose and what are the investigations. First of all guys, you'll go for the peripheral blood smear examination, PBS examination. Okay, what can be the causative agents? It can be Plasmodium vivax, it can be falciparum, it can be oval or malaria. Okay, after that guys, two slides will be taken. Two slides will be taken. Question was asked, who is preparing these two slides, my dear students? Multi-purpose worker male. Question number 1, malaria is very important. Two slides. Okay, what are the two slides he will make, my dear students? He will make thin slide, okay, and he will make thick. Thin will tell me about a species, it will tell me about species of malaria. Okay, and thick will tell me about, and thick will tell me about, thick क्या मुझे बताएगा? Confirmation. Thick will tell me about a confirmation. So thin will tell me about a species and thick will be tell me about confirmation. Two slides will be taken. Only one slide will be taken in which condition guys? Filariasis. Thick smear will be taken in the night time. Then after that guys, we have a rapid diagnostic test. We have a rapid diagnostic test or rapid diagnostic kit. Okay, it is an antigen detected. Antigen detected. Which antigen guys? Histidine rich protein, HRP2. Histidine rich protein. For the diagnosis, we also check, my dear student, LDH. Okay, we also check LDH, lactate dehydrogenase. Chalo. After that, agents. If I talk about agents, guys, most common in India is Vivex. But most dangerous is falciparum. That's why the pathology you study guys, वो banana shaped RBCs होती है, falciparum. Okay, Vivex and falciparum. Okay, one more important thing guys, you will remember the treatment. Okay, remember the treatment. Okay, if Plasmodium vivax, then chloroquine in all the states. Chloroquine in all states. Remember this thing. If Plasmodium vivax, you'll give chloroquine in all the states. If it's mentioned that it is Plasmodium falciparum, if it is Plasmodium falciparum, then guys, two things, two treatments. Okay, if northeastern states, then you give ACTL with lumefantrine, and if other, you will give ACTSP. You'll give ACTSP. Is it okay? ACTL in northeastern and other ACTSP. Okay, so remember guys, malaria related guys, all the things, thin and thick smear is okay, histidine rich protein and LDH level and peripheral blood smear, and thin will tell me about species, and thick will tell me about confirmation of the malaria. Okay, and best indicator of the recent is infant parasite rate. Remember this. If it's a pregnancy, that's why I've showed you this. If there is a malaria with a pregnancy, my dear students, remember Plasmodium vivax, chloroquine will be drug of choice for all trimesters. But if Plasmodium falciparum, first trimester will be quinine, second will be ACTL in northeastern and ACTSP in the other states. Okay, northeastern states, Plasmodium falciparum, not in a pregnancy, normals guys, artemether, lumefantrine and primaquine, and here artesunate and sulfadoxine will be your treatment. Is it clear guys? All these things important about a malaria guys. I've already told you guys, peripheral blood smear will be taken. It's prepared by multi-purpose worker male at the PHC. 2 slides, thin and thick will be there. Okay, thin and thick will be there. Thin will give me a species, thick will give me a confirmation. We have RDT kit which will detect HRP2, histidine rich protein 2, and also we check LDH levels. That is all about guys malaria, which is very important. Okay, now next question guys. A woman who is lactating came to the OPD 6 weeks after the delivery of checkup and to get the advice for contraception. Okay, which of the following is not advised? So contraception of choice in lactation, guys, क्या है? In lactation, progesterone only pills. I've repeatedly told in my main classes guys, it is progesterone only pills. Even the lecture that I've taken on this Meduhub platform, on the first very lecture of the PSM, I've discussed about contraception family planning. उसमें मैंने बता दिया कि progesterone only pills are the contraception of choice in the lactation. Why? Because if you give estrogen, that will cause imbalance in the lactation. Estrogen lactogenesis में problem कर देगा, है ना? So what is your answer? Progesterone. Which of the following is not advised? Combined OCPs. Now how long you have not advised guys? At least until exclusive breastfeeding, 6 months. Okay, if the woman is not lactating, then 6 weeks tak. 6 weeks if not lactating. 6 weeks if not lactating. Now if I talk about the OCPs, my dear students, these OCPs, combined OCPs, okay, they increase some cancers. They either increase the risk of cancers. Like what are the cancer risk? They will increase breast cancer, है ना? Cervical cancer is also caused by HPV 16 and 18. More precisely, you go with the 16. It also causes guys hepatic adenoma, females having hepatic adenoma or hepatic hemangioma. They are all the cancers that are increased by the OCPs. What are the cancers that will be decreased by the use of combined OCPs? What are the cancers? So the cancers are endometrial cancer, ovarian cancer, and uterine cancer. But endometrial cancer, it's increased by which drug? That is a selective estrogen receptor modulator, tamoxifen. It causes endometrial hyperplasia, my dear students, and predisposed to the hyperestrogenic state, endometrial cancer. The classical picture of the endometrial cancer: a patient will be obese, patient will be hypertensive and diabetic. ठीक है, and along with that patient can complaining of the post coital bleeding or the post menopausal bleeding. Post coital bleeding mainly है ना, because it helps, not post menopausal, post coital, because it usually occurs in the young age. Endometrial cancer है ना, hyperestrogenic state. Can endometriosis cause endometrial cancer? No, याद रखना, ठीक है. So endometrial cancer, which drug? Tamoxifen. That is why rather given, tamoxifen is a drug used in the breast cancer है ना. That is why rather than using tamoxifen, we use a drug called as raloxifene. Okay, this raloxifene estrogen receptor modulator is also used in a patient having osteoporosis है ना. Osteoporosis में what is the treatment, guys? If a female is not in a menopause, estrogen. If menopause, bisphosphonates. ठीक है ना. Osteoporosis. चलो, raloxifene, tamoxifen नहीं देना है, raloxifene देना है. Selective estrogen receptor. It causes what? Endometrial hyperplasia. यहाँ पे लिख देता हूँ, it causes endometrial hyperplasia. This is a multiple times asked this question है ना. So that was all about combined OCPs है ना. Then guys, contraindications of these OCPs: you have relative and absolute contraindications. What are the absolute contraindications? Like the patient having a liver disease, you don't have to give because it causes hepatic adenoma and hepatic hemangioma. If the patient is having a history of a breast cancer in a family, you don't have to give. Okay, so a patient having multiple sex partners, you don't have to give. Okay, and relative contraindications like migraine, deep venous thrombosis, cardiovascular disease, those are the relative contraindication of combined OCPs. Combined OCPs में क्या आता है? माला N and माला D, estrogen plus progesterone. What is the estrogen? Ethinyl estradiol. What is the progesterone? You have levonorgestrel. Is it okay, coach? So that was all about this. Okay, and guys, I wish you all the good luck, and I hope this discussion, all these three parts, these agents and factors I've discussed in the part 1. Again, no need to write again, है ना? So all the best, guys. I hope the session was good enough and interactive enough, and you go through this session fast. It will be a very useful for you all. Okay, soon we'll come with a new other session, new other chapter or any other topic. Okay, so meanwhile, guys, anyone, any question, any doubt so far, you guys can write down in the comment section. I'll be watching your comments for 2 minutes. Anyone? Yes, you can solve the questions on my channel FMG with Dr. Talib Bilal every day. The schedule is already over there. So to boost your preparations, do those questions in the free time, है ना. Rest focus in your notes and GTs. All good, guys? Understood? It was a rapid review. It will be only useful if you have gone through your main notes. But yes, I explained things 70-80%. But yes, there is a lot to explain, guys. Watch the discussion of obstetrics and gynecology as well. That is also very high link. Focus on the previous year topics rather than previous year questions. Okay? PYTs are important than PYQs. Okay, topics will be always same, but twist will be high. Okay, examiner will change the language of the question. Topic same ही रहेगा. Okay, guys, all good? Any doubts? Yes, you guys can write it down. Anyone? Faster, guys. Keep studying, है ना? We are almost it's 10. We are almost 55 days away from the exams. So keep revising, keep answering, and don't compare your knowledge. I will again say, don't compare your knowledge with anyone. Run your own race. You can be strong in OB-GYN, you can be strong in medicine. The other person will be weaker in OB-GYN or medicine. Okay, doesn't matter, but you have to try. Don't skip a single subject. Try to cover all 19 subjects, and you got this. And guys, all the best. If you have any doubts, only you can ask the doubts on the Telegram, but only doubts related to the studies. Okay, that's our most welcome. Keep solving, keep studying. All the best. I hope this session will help you all. Good luck. Allah Hafiz.